I'll suck my gut in so I look better. I don't want Brad Pitt to get too jealous, so. So anyway, I'm checking, these are somatosomatic reflex points. That's slightly reactive, and the magnitude of the reaction is not what we're looking for, just the reaction. So these points here were a little more reactive on this side, I thought, than this side initially. Then we're looking at that joint motion there, just from getting them to move. That's not too bad. That's not too bad as far as motion, but there's a little painful component to it. See how his head goes up? And then we're getting stiff here. He's avoiding a little bit. Pretty sore up here. So the joints we're going to work on initially are your lumbosacral and SI joints. And we're going to adjust those with the long lever technique that will actually use the leg to get the adjustment. When we do that, the muscles that flex these joints are your abdominal obliques, which attach from the pelvic bones to the rib cage, and then also the straight abdominal muscle, which attaches from the pubis all the way up to the sternum. So after we do this, we'll reassess the back, because a lot of times the tension of these muscles from the pain here will cause this decrease in back motion, because the rib heads are really what's sore, not necessarily the set joints. So the human has a disc about this thick. The horse has a disc about this thick. I don't see a lot of true back pain in the horse. I see a lot of rib head pain, which is still on the back. So we'll adjust this first real quick. And here we go. Easy does it. There we go. We got a slight audible there. We like it when they look at you. Doesn't mean your adjustment was any good, but it means they're not in terrible pain. You haven't broke their leg, which is always good.
He's licking.
Yeah, and I let them get done talking. You know, I think it's very important that they talk. I have no idea exactly what they're saying, but now this one, we're adjusting that sacroiliac ligament. And that doesn't look like much of an adjustment. That's probably the most important adjustment we're going to do today. Okay. Now see right here, the somatosomatic reflex point is very clean, not much motion. I adjusted this one and this one. I did not adjust this one. See the response? And we're not looking for him to fall down and cry and scream and all that, although some horses do, they're that sort. We're just looking for a reflex response, and then the lack of reflex response. And that just tells us that we got done what we wanted to get done. And that's all it says. There we go. Another slight audible. Good. Easy does it. No, I want this one. That's a boy. That's a man. Easy does it. Easy does it. Gotcha. So we look for the lack of a response. Now we're going to go recheck the back. And I'm going to do it from the other side because that's where I started.
Okay.
And we always like to retest exactly the way we tested the first time, so there's no other variables involved. Okay. So that's still pretty good motion there, and you notice a lot less tenseness. I don't know if you notice it on film, but I feel a lot less tenseness. When we get up here, there's still tenseness. See the look in his eye? He's a little concerned. Now he's moving away. So we did clean up a little bit here just from doing this, but we have some rib head stuff to work with. Now, I've gone and pushed on him and made him sore 3 or 4 times. He wants to see what I'm about, so he's going to smell my pheromones. He wants to see if I'm angry. He wants to see if I'm hungry. I don't think he's interested if I'm sexually attractive, although pheromones can tell you that too, just so you know I am. Sorry, I don't know movies. So, if I didn't tell you, you might not figure that one out. So I am going to go ahead and adjust the rib heads. And if I was mad and angry and hungry, they get tenser. You know, you've really got, see, he's interested because it hurts. Those rib heads are up here. There's 2. There's what we call coastal vertebral joint, which goes between the rib, head, and right between the two vertebrae, and then there's a coastal transverse that goes on another little spot on the vertebra, but it's not in the vertebral joint. So they are sore areas. I hope they feel better when I'm done, but they probably hurt while I'm there. They definitely hurt when I first push on them. And you know, contrary to popular belief, we're pretty sore in there. We're really not putting bones back in place. We're stimulating nerves a certain way, and when we do that, mechanoreceptor nerves to a great extent can outshout the pain nerve, and you get a response that can last 3 to 4 weeks with neurological pain reduction. And then during that period of time, you can use those joints and they can heal. But we're probably not making them heal right now today. We're just taking the pain away, and then he can go ahead and use them. When you use something, it gets more blood supply, and then it has at least the opportunity to heal. You can see he's still pretty concerned about all this. There we go. Gotcha. Gotcha. The last 10 ribs in the horse are floating ribs. And it's the last 10 that I'm adjusting on this side right now. And I've had to go back. We usually only adjust a rib head once, but I could only get, like, I got 8, 9 first, and then then I've got, then I could get one up front, and then I had to go back with the middle ones. So I think I got all of them on this side that I can do. We'll do the other side, and then we'll get the first 8 ribs are sternal, and the 4. So those we have to adjust different way. These ribs go in and out. These go in and out this way. So we're going to test. Pretty little sore there. Not quite as sore there. Pretty stiff and sore right there. I can tell you that right now. And not quite as bad there, but right in here we're pretty tight. So we'll start here. Does it? Boy, gotcha. We even had a good audible on that one. All right. There you go. Now, did you notice he didn't seem as upset about this side? He's not near as sore on this side. So those are things, that I feel are moderately important. We take note of that. I thought he was sore here, stiffer here. He's definitely sore here, and not so bad on this side. So now we're just going to go back and retest that joint mobility in the horse's spine. If they can do this, they can usually do that. They can't do this without doing that. So I always test this first. If they can't do this, I know they can't do that. So we want to, and see now he's a little tense. So you can really be confused by this. And you say, well, he's a lot stiffer. He's not stiffer. He's just tensing up. He'll relax here in a second. That's a boy. There we go. That's pretty good, but we still have a little pain. That's a lot better. That's a lot better. Still a little bit of pain, but we're not done yet. We get up in here, and not a whole lot of improvement here yet. So I'll get Helen to help me. Helen? Helen?